Enzalutamide is an anti-androgen. Anti-androgen have been extremely popular 10 years ago with a drug like bicalutamide because they do interfere with the androgen receptor in a quite neat way. So these are, I would say, the absolute targeted agent for prostate cancer, which is an AR-driven disease. In comparison to bicalutamide, enzalutamide is a much more powerful drug. I would say that's an extremely effective anti-androgen. It has followed a traditional development, meaning that it was first tested in post-chemotherapy. And now we just presented the result of PREVAIL, so in pre-chemotherapy, where clearly it demonstrates its whole potential. Why? Because this is a population of asymptomatic patients or moderately symptomatic, so any toxicity will be not welcome, and the drug is absolutely has very little toxicity if you compare to the placebo. It is a drug that is extremely easy to administer, that doesn't require monitoring, and which has unbelievable oncological outcome because the progression-free survival was delayed. Very importantly, the time to chemotherapy was delayed by 16 months, which is unbelievable, which is unprecedented, and it has an impact on overall survival with, in the current environment of multiple drugs, in a study where most of the placebo patients were treated 4 to 5 months after entering the trial, was a challenge. Because most of these patients have received AB, docetaxel, blah, blah. So it was a challenge to hit survival, and we did it. So clearly, I don't want to look biased, but that's really a drug with a huge potential to the future. On top of that, there is something also extremely interesting, is that you can foresee, but not now, I mean, with a longer, a longer horizon, I would say probably 5 to 10 years, that this drug could be used alone, not on top of androgen deprivation therapy, but instead of androgen deprivation therapy. In patients for which androgen deprivation therapy is required, but we not necessarily are going for increase in overall survival because it's working very well. But what we are looking at is an efficient alternative, but that spares some of the side effects. And that's the idea of testing this drug in hormone naive. So far, we have no comparison data. What we know is that it fits the description of a drug that can achieve tumor control without inducing castration side effects. Now, the registration pathway for very early use like this is quite difficult. So that's why I say it's a 5 to 10 year horizon. But I'm still dreaming with the fact that, you know, in 10 years from now, if you need like 6 months hormone therapy together with radiation therapy to increase its side effect, you could receive an oral drug that would be as effective but with limited side effects. So that's the idea around enzalutamide. As for now, clearly we are waiting FDA and EMA approval for the pre-docetaxel setting, and it is clear that considering the efficacy, the toxicity, and the convenience of the drug, it will probably take over as a first-line drug for many, many patients on the planet. Enzalutamide is such a powerful agent that basically everybody feels the need to repeat all the setting we did with anti-androgen. So trying clearly to move it earlier in non-metastatic castration-resistant prostate cancer, in patients who have a PSA recurrence after radiotherapy or surgery. The problem in that group is that that's going to be very, very long trial, and it's going to take years before we have the answer. That's for moving it earlier. So everybody wants to move it earlier. We will do it, but it's going to take time to get the answer. No, because it's quite non-toxic, it's also a perfect companion for any combination you can dream about. And I heard that the company is now having at least close to 40 trials going on. So there's going to be a lot of trials done with enzalutamide because that's, you know, that's the best bribe so far. So everybody wants to get with her. So that's clear.